Good day. I am Julian and I am here to discuss the case of Mark, a 15-year-old who was prescribed Wellbutrin bupropion for his depression. I need to cover the important points that I need to include in his teaching plan that I am preparing for Michael and his parents. So, what is the textbook definition of depression? The textbook definition of depression is said to be a medical illness that negatively affects how a person acts, feel, and think. Textbook symptoms said that people with depression feel constant sadness, low self-esteem, less functionality, and loss of interest in their hobbies. But not all this manifests to people with depression. I know some who looks confident, well composed, has a jolly personality, and very functional. You won't even have the slightest idea that they are depressed. Important points we need to discuss that will be included in the teaching plan is first, what is the medication? Wellbutrin is an antidepressant used to treat major depressive disorder. So they need to make sure that the patient takes the right dosage prescribed by the physician. The recommended dose is 200 mg per day given as 100 mg twice a day daily. When a dose is missed, do not take an extra dose to make up for the dose you missed. Wait and take your next dose at a regular time. Family members should keep a close observation to the patient whenever the patient is taking the medication. Make sure that the patient really takes them. To be thorough, make them open their mouth and make sure that they don't hide the medication on the spaces inside it. There are some clinically diagnosed patients who seek help and are compliant with their physician's advices and prescribed medication, but they still commit suicide. The great factor to prevent this is for the person to have a strong support system. Friends and family should try to ask them how they really are. Lend them your ear and try to listen to them. Most depressed people feel alone and they just want someone who really wants to hear them.